Hello, Partnering for Vaccine Equity, or PAVE learning community members and others working to advance vaccine equity. Thanks for your patience while we sorted out a few technical issues as we prepared to start the webinar. But I am Bridget Courteau. I'm the Director of Group Learning for the PAVE learning community. And on behalf of our team at the Urban Institute and our partners at the CDC, thanks for being with us today. We know that securing funding to keep your community-based health programs going can be a very stressful part of your work life. If you're looking to sustain or expand your organization's vaccine and health equity activities, it's tough to even know where to begin. And this afternoon's learning session will be full of tips and tricks that we hope will make the process of finding and applying for new funding a little less daunting. We'll start off with a short presentation on how to find funding opportunities and then move into a panel discussion featuring 4 PAVE-funded organizations that have recently won federal awards for health equity initiatives. Before I introduce our speaker and panelists, I'll review a few key points about how this session will work. First, we offer live interpretation from English to Spanish during our events. If you'd like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. You've all been muted upon entry to the session. If you have a question for our speaker or our panelists during the presentations, we ask that you use the Q&A tool in your Zoom taskbar to submit it. We'll also have dedicated time for questions and answers at the end, and you can also ask your question live at this time if you like. Just use your raise hand feature at that time. We'll take you off mute so that you can speak. The chat room feature is also open today. We encourage you to use it to introduce yourself or to comment on what you're hearing. However, please try not to put your questions for the speakers and panelists in the chat because we might miss them there. Submit them via the Q&A instead. And if you have technical difficulties at any point during the session, send an email. Hold on one second. Send an email to our manager's inbox, which is vaxequitylearning@urban.org, so that we can assist with troubleshooting. And finally, as with all of our learning events, we will post the slides and a recording of the events, both in Spanish and in English, on our community website and circulate them through the digests that go out through the CDC-managed Adult Vax Program listserv, which all PAVE members should be a part of. For this session, we'll also send the materials out to all registrants so that even those who aren't part of the PAVE community will have them. And those materials will also include a list of funding opportunities that our first speaker has compiled just for you. Okay, and speaking of our speakers, it's now my pleasure to introduce our speaker and panelists and share a little bit about them. Chelsea Toledo, our featured speaker, is a public advisor to the Partnering for Vaccine Equity program. Chelsea works as an ASRT contractor to CDC and provides expertise on community engagement and outreach. She also worked for 6 years at the Task Force for Global Health and served as the lead for communications, development, and events for the Coalition for Operational Research on Neglected Tropical Diseases there. She has held health communications positions at the Pew Charitable Trust and the National Institutes of Health, and holds a master's degree in health and medical journalism from the University of Georgia and an MPH from Emory. She's a certified health education specialist. And now here's a bit about our awesome lineup of panelists in no particular order. Dr. Sari Sanchez is the medical director of the Infectious Diseases Bureau at the Boston Public Health Commission. She received her medical degree from the University of Puerto Rico School of Medicine. She completed an internal medicine residency at the University of Pennsylvania and completed a subspecialty fellowship in infectious diseases at the Massachusetts General Hospital in 2020, and completed the Commonwealth Fund Fellowship in Minority Health Policy at the Harvard Medical School and obtained her MPH from Harvard School of Public Health in May 2021. Dr. Gloria Montiel serves as Assistant Vice President of Grants and Community Engaged Research at Ultimate Health Services, which is one of the largest federally qualified health centers. She's a health equity leader, a researcher, and a faculty fellow. Over the last 10 years, she's partnered with community residents, promotoras, and other partners to design grant-funded programs in chronic disease prevention and management, mental health, housing and financial stability, and civic and community engagement. Her professional and academic work is informed by her lived experience of growing up and navigating education and health systems as an undocumented individual, and she's been a DACA recipient since 2013. And Liani Arroyo has been the director of Hartford's Department of Health and Human Services since December 2017. She's expanded the department's work to include chronic disease prevention and reducing deaths due to opioid misuse, and is leading Hartford's public health response to COVID. Prior to working for the city of Hartford, she was senior director for health equity at Power to Decide, where she oversaw a research project to prevent teen pregnancy, and served as the organization's director of partnerships. Liani also served as the associate director of the Education and Children's Project and director of the Institute for Hispanic Health at Unidos US. She holds a BA from Wellesley and an MPH from Columbia, and is certified in public health. And Aaliyah Southworth is the program director for the chronic and infectious disease programs at the University of Chicago School of Medicine, Center for Asian Health Equity, and Asian Health Coalition. She has over 10 years of experience developing and implementing community-based prevention and health education programs within Asian and African refugee, immigrant, and migrant communities. Aaliyah's background includes extensive practice in grant writing, program evaluation, quantitative and qualitative data collection, analysis, and community outreach. And her experience includes individual policy, system, and environmental strategies in areas of hepatitis B, cardiovascular health, diabetes, obesity prevention, substance abuse prevention, access to care, and vaccine hesitancy. It's quite a lineup. Thank you all for taking the time to be with us this afternoon. We're really excited about this event. Now we can get started. Chelsea, the floor is all yours.
Thank you so much, Bridget. I'm so thrilled to be with you all here today and to be with this incredibly esteemed lineup of speakers. So your presence here today, you as attendees, tells me that you're interested in sticking around in the field of health equity, and for that, I commend you. So as Bridget mentioned, the purpose of my presentation is to provide some pointers for finding funding opportunities in this space. And I'm going to try to keep my remarks as brief as possible because the real treat is what comes after. You'll be hearing from some of our partners who recently applied and were selected for federal grants related to health equity. So if I move a little fast, don't worry. Again, like Bridget said, we're going to share the slides along with a recording from this presentation, as well as a running list of funding opportunities that we know about to everyone who registered for this event. So we have allowed time for questions, although I know that we took a little time with our technical difficulties. I do apologize. So let's get started. Next slide, please. So who is this presentation for? It's for organizations interested in identifying potential funding opportunities, of course. So looking at the registration data, it seems that most of you are either seeking funding immediately or that you plan to do so sometime during the next 1 to 3 years. And so if your need is immediate and you didn't see this, I wanted to let you know that CDC Foundation has issued a request for applications on reducing disparities in monkeypox vaccination that closes tonight at midnight Eastern Standard Time. So from what I understand, the application process for this request for applications is actually a little, much more quick and streamlined than what you would experience with a federal grant. So you might well have time to apply for it if you haven't already. I'm going to share that link in the chat if that is of interest. Next slide. So I promise I'm going to get into the good stuff, but first, some disclaimers. So I'm going to be presenting information provided by grants.gov, as well as the Office of Minority Health and NACCHO. Please note that I do not work for or represent any of these organizations. So you're more than welcome to ask me questions about what I'm presenting, but please note that I will be answering them as a user of those resources. For any official guidance, I would direct you to the organizations and agencies themselves. The second disclaimer is that I do not, in fact, know about every available funding opportunity that exists. So if you know of another place to look for funding that I don't mention, please feel free to share it with the group. And then lastly, I'd like to mention we'll be talking about a newsletter that I work on the CDC side. It contains links to funding opportunities. If after hearing about that resource in this presentation, you're interested in being added to the distribution list, you may contact me at rnv8@cdc.gov and I will facilitate that request. Next slide, please. And now for the actual presentation. So if you are looking for a federal grant opportunity, the place to start is grants.gov. And as you can see from this screenshot, grants.gov is both a website and a mobile app. So just in case you're searching for federal funding on the go, you can get it on your phone. So at the end of this presentation, I have included a resources slide. It has links to a wealth of information to help you get acquainted with grants.gov and how to use it. Next slide. So now I'm going to show a 1-minute video on how to search for a grant. And Bridget, we might need to switch who's sharing screens here, unless you can, click on that link. This is a sample from a larger playlist of how-to videos for grants.gov, which is linked on the resources slide at the end of this presentation. So during the registration process, the bulk of you reported that you are either slightly or moderately familiar with grants.gov. But if you are one of the few who said you're very familiar with grants.gov, I'd advise you to just relax and enjoy the lovely background music for the next minute. And Bridget, I can share that on my side if you can.
Yeah, well, I do think that I may not be set up to video share because I know Zoom requires some audio things. So let's stop the sharing for a second.
No
And then I think you have the rights to share.
And then I think I'm sharing sound, but just let me know. But this is a 1-minute video.
One of the core functions of grants.gov is its use as a tool to search for funding opportunities. There are 2 ways to conduct a search for funding opportunities on grants.gov. On the top right corner of the website, you can conduct a quick keyword search by entering a word or phrase and clicking the Go button. The results will appear on the main search page, where you can narrow and tailor the search. Clicking on the Search Grants tab will take you to the main search page, where users can search by keyword, funding opportunity number, and CFDA. Results can also be filtered by status, such as posted opportunities or forecasted opportunities, by funding instrument type, such as a grant or cooperative agreement, by eligibility, such as county governments or small businesses, by category, such as energy or education, and by agency, such as NASA or the Department of the Interior. Clicking on the funding opportunity number will take you to the grant opportunity page. Here are a few additional notes about using grants.gov search. Search results data can be exported as a CSV file by clicking the Export Detailed Data link on the top right corner of the search results grid. Searches can also be saved and managed, provided that you are a registered user and are logged in. When browsing search results, click the Save Search button. You will then be able to give the saved search a name. You can manage your saved searches by clicking on the Manage Searches link and selecting either to edit or to delete the saved search. Moving forward, when a new opportunity meeting your search criteria is posted, you will receive an email notification. Questions about this video or another grants.gov topic? We encourage you to make full use of grants.gov's online training resources.
All right, so like I said, that jazzy video was just one in a whole playlist of helpful videos from grants.gov. They have one for grants.gov, they have one for the grants.gov mobile app, and all of that is linked on the resources slide at the end of my presentation. Bridget, I think I'm just going to keep screen sharing and just skip over that one slide just for the ease of the demo. Let's go are you seeing grants.gov on my screen?
Yes, and I'm wondering if folks are seeing the tech problems we were having before we got started with gray bars. I am not seeing that, Chelsea. Let's check though and make sure before we go ahead this way, so that all the audience can see. Let's see, could folks chat us if they're seeing gray bars on Chelsea's screen share? Okay. Yes to the gray bars. Yes to the gray bars.
Oh no. Okay, so if I close this, I'm so sorry about this. Is it covering everything?
It isn't. It's a toss up, right? I mean, it is easier for Chelsea to share, and you don't have that many more slides, right? So maybe let's just go ahead. Folks, you'll be getting these materials after, as you know, and there will be no gray bars. So for convenience and ease of time, let's Chelsea keep sharing, and we can talk.
And this isn't the slide, so this is just the demo, and then we'll pick up the slides from there. We just saw in the video, what that demo looks like, but just to show you, what that could look like. you know, how you could make your searches narrow, your search results narrower or expand them, just depending on how you handle your parameters. And in the slide, we do have a slide that shows examples of parameters. So here I'm at grants.gov, and in that top right corner, I'm just going to type equity, which is hopefully something we all care about. As you can see, I have 413 matches that automatically pop up, and I want to refine that a little bit. So, you know, it's good to look at forecasted grants so you can see what's coming down the pike. But if you're, you know, immediately applying for something, you can't apply for something that has not yet been posted. So I'm going to uncheck that so that my opportunity status is just posted. That narrows it down to 333. Now, this really just depends on your needs, but let's say I'm looking for a cooperative agreement. And a cooperative agreement differs from a grant, just the level of involvement of the federal agency providing that funding. So in a cooperative agreement, the federal agency is more involved and provides more support. So I know that someone in the registration process asked about eligibility. So this is the field where you would be able to refine your results to see, you know, who's eligible for what. So just for the sake of this exercise, we're going to say that I'm looking for opportunities for which 501c3 nonprofits are eligible. And let's say, okay, I work in health equity. I want to narrow it down to health. You can see it's just narrowing. We got it down to 34. And I was going to say I wanted the HHS, the Department of Health and Human Services, which houses CDC, NIH, and FDA, but it already got there. So I don't actually need to check that box because that's the only one that's currently available matching these parameters. So you can see if we scan our list here, there's something about cancer, health equity, chronic disease, rural, community partnerships to advance science. So looking down the list, there might be something that's of interest. I like this one at the bottom, and I actually just saw this one today. So it's not on that list that we had prepared to send out after, but we can try to get that out in the post-meeting materials. So like they said in the video, you click on that little number and this grants notice will open. Approach to adult vaccine counseling. You can see this is being provided by CDC. You can see that the award ceiling is 500,000. It's 400,000 as the floor. They're going to put out 1.5 million. So they're probably going to put out about 3 of these grants. And this is who's eligible. There's more information on eligibility and just, you know, who you can contact from here. Now, one thing I really want to get across, and this is actually on one of my next slides, do not make the mistake that I made when I first started searching grants.gov, which would be going to your browser window and copying this link and sending it to someone and say, hey, check out this grant opportunity. Because guess where they're going to end up? Not here. They're going to end up back at that search page looking for all equity. So if you want to share just this one grant opportunity, this is not intuitive at all, and I do apologize, but you're going to click this your tiny little link thing in the right-hand corner, and then a link will appear that you can copy and paste. So that is a lesson that I learned the hard way, and just a quick little demo. So Bridget, we can go back with the slides.
Okay, thanks. And Chelsea, I am sharing, I just had ready to share your list of funding opportunities. If that works.
Perfect.
If it's the right time, I'm going to share that. So this is a public link. We'll share this around after the event too. Let me go back to my screen share here. Let's see.
Thank you so much. And again, thanks for the patience, y'all. Okay, so just kind of click ahead to the slide that says key steps of the application process. And then we will get going with our panel very shortly. So my presentation focuses on finding funding opportunities, but I did want to let you know that CDC has resources to help you apply for them. So here's a list in brief showing the key steps of the application process for federal funding. I'm not going to read this out loud, but just note that this is linked at the bottom of this slide as well as on that resources slide. So when you get the slides, you can really dig in. Next slide, please. So now what if you're not necessarily looking for just federal grants? Or if you're one of the handful of people who registered for this event who said you're just browsing for funding opportunities and your need is not super immediate, well, whoever you are, regardless of your status, I do encourage you, if you are working in the field of health equity, please sign up for email communications from the Department of Health and Human Services Office of Minority Health. They have this wonderful newsletter called Weekly Health Resources, and it contains all kinds of things. In addition to funding opportunities, there's events, resources, clinical trials, information on workforce development, and recommended reading. Just note, you can see a little screenshot of the funding opportunities that are provided in that newsletter. But just note that they're a broader, it's not just vaccine equity. It's going to be, all things related to minority health. There's a link here to subscribe to this newsletter. So I do encourage you to do that. Next slide. So other places you might want to look include the National Association of County and City Health Officials, or NACCHO, as well as AmeriCorps. So NACCHO posts funding opportunities mostly for local health departments, who's their primary audience, but there's also additional consultancies and other opportunities. So that is a good place to look. And then I did want to call attention the AmeriCorps application cycle, including for their 2023 public health opportunities, which are listed here. It's open with an application deadline of January 4th. So if that's something that is of interest, there are links at the bottom of this slide. Check that out. Next slide. Almost done, I promise. So at the beginning of this presentation, I mentioned a quick update newsletter. So if you are partnering for vaccine equity or PAVE partner, chances are you already get this, but also chances are you're one of the 60% of people subscribed to this newsletter who do not open it. So if you do not open this newsletter, this is actually what you're missing. Every other Tuesday, we send a quick update email newsletter, which contains a featured funding opportunity at the top. Sometimes it's a funding opportunity, rarely, but sometimes it's just an opportunity to submit a paper or something, and then a list of open funding opportunities down below. It's all public information. We don't share anything, that's proprietary. It's just stuff that I found online with the opportunity to contribute to it. So if you are not getting this and you want to be, please contact me. My email is listed on this slide. All right, next slide, please. So that concludes my planned remarks today, but here are some of the resources I mentioned, and these are specific to grants.gov. Next slide. And here are some of the additional resources and recommended actions to take to help you find and secure funding. Those recommended actions include checking out CDC's grant page, NIH's grant page, NACCHO's funding opportunities, AmeriCorps, as well as subscribing to that OMH newsletter, making sure you're getting that one that I send out. And then there's a little link there from one of our partners in our CREM about building a strong application. We do have, the next slide is questions, but I wanted to see, maybe we should just move on to the panel and see if we can address questions there, if that's all right. But if you know of other funding opportunities and places to look other than what was just mentioned, please do feel free to pop that information into the chat. But with that, it's time to shift to our panel discussion. So I'm going to ask our panelists, Dr. Sanchez, Dr. Montiel, Liani, and Aaliyah, to begin turning on their cameras. And while they are doing that, I wanted to provide a bit more information on the grants that they have applied and were selected for recently. And both are from the HHS Office of Minority Health, which provides that newsletter I told you about earlier. So the first set of grants is for a program called Community-Driven Approaches to Address Factors Contributing to Structural Racism in Public Health. And we were very proud when this was announced to see 4 Partnering for Vaccine Equity partners listed among the 10 organizations selected to receive funding. So representing that group today, we have Gloria from Ultimate Health Services Corps, Sari from the Boston Public Health Commission, and Liani from the City of Hartford. And the second set of grants is for a program called Promoting Equitable Access to Language Services. And among the 11 organizations selected to receive funding for this program is the Asian Health Coalition, represented today by Aaliyah. So welcome and congratulations again to our esteemed panelists. I think we can stop the screen share, and kick off our panel discussion. So first, what we have planned today is a little quick fire, a set of quick fire questions. So I've got 3 questions and we'll just go down the line. I'll call your name and just provide a really brief answer, which will leave time for the longer questions. So our first quick fire question today is to tell us how you learned about the funding opportunity that you applied for. We'll start with Gloria.
It came in a newsletter, actually. We subscribe to updates from grants.gov, and it came in a newsletter.
Yay, good for you. Okay, Sarimed.
I actually learned through a colleague. And so sometimes really having colleagues that know your interests and your programs can be very helpful to pass on the information.
Wonderful point. Next, Liani.
we subscribe to the Office of Minority Health newsletter, and that's where I first saw it.
And last, Aaliyah,
Same, the newsletters and listservs.
open those emails, folks. I know it takes time, but it can pay off literally. So our next quick fire question is a two-parter. How long did it take your organization to prepare your application, and how many people did you have working on it? So first is Gloria.
So it took us about 6 weeks from beginning to end. We had 4 people actually contributing to the writing, but we also had community members contributing to the concept, and then our evaluation partner also contributing to the evaluation section.
Fabulous. Next, Sadi.
Very similarly, around 5, I would say 4 to 6 weeks from what I recall. And, we had we do have sort of, dedicated grant support and writing team that sort of helps around 1 or 2 people. And then similarly, also really trying to convene members from our own program, which were around 1 to 2, and then also members from the research team, which were also around 1 to 2, so 6 people.
Great. Next, Liani.
So it took us about 2 weeks to really think about what we wanted to do and conceptualize that into a way that made sense, and then about 2 weeks to write it. And then we engaged a grant writer that we've worked with previously. And so between the 2 grant writers and our staff, there were probably about 4 folks that touched it.
Wonderful. And our final quick fire question.
Mhm.
How long did it take? Oh, I'm so sorry, Aaliyah. Go ahead. I'm sorry.
Oh, no worries. So it was about 3 weeks for this one, and we had 3 kind of major people working on it, but we also pull from, evaluation and other aspects for different pieces.
Great. And so sorry again for skipping over you there. I got excited about our last question, which is how long did it take to hear back from the funder with a decision? And I have a feeling for the first 3, it might be the same, but let's hear it. Gloria.
Yeah, I'm wondering if anyone has the exact time. I remember it was due either late July or early August, and we heard back middle of September.
Is that Liani and Sadi? Is that your experience as well?
Yes.
I'm seeing nods. And what about you, Aaliyah?
That's the same. It's about 2 months that it took from submission to hearing.
Perfect. All right. So thank you again for the quick fire. Being patient with me there. We're going to move into our longer form questions. These are really meant to be conversation starters. So I won't call your name. I'm encouraging you just to jump in and let's talk. So again, congratulations to all 4 of you on your successful proposals. What do you think it was that made your proposal stand out?
So I can start. I think that it's a combination of things. One, our experience in just working with the community and our vast partnerships, but we also have a vast database that we collect of disaggregated data that we collect ourselves, and we're able to utilize that in these grants. And I think that having, this data from other grant programs and such, especially in a disaggregated manner, really helps make us stand out. And the final thing is, honestly, it sounds so simple, but it's something that I find a lot of people miss, is just answering everything that they ask in the RFP. And at the end of the RFP, make sure and read through those 70 pages, because at the end, they lay out exactly how they score those applications and exactly what they want. And for the most part, they're not cryptic about it. They are telling you exactly what they want. And so by being able to, answer those in a way that, applied to our program, I think, is what made us stand out and successful.
I think similarly for ourselves, we as a local health department, we do have readily available data that we can very quickly collate. And I think that is an advantage when it comes to when you learn about applications. You often are facing a hefty timeline for all of the reasons that many here on of my co-panelists have mentioned. So I do think that, based on your interests and sort of your planned projects, I think having that data available, some data available, I think is always helpful, particularly when it comes to racial ethnic disparities, as well as sort of your communities. I think having a preset kind of set of materials around like your community reach, your impact and partnerships, as well as data, can be very helpful when you're facing these timelines.
I think for our application, and I'll give a very brief context about what our application entailed. So during COVID-19, we were a recipient of one of the HRSA grants to build community workforce to address vaccine equity. And so over the last year, as a federally qualified health center, we've been thinking about this issue of how to bring health from the clinics into community as well. And so we have trained individuals, have done extensive community engagement, so building upon that. So it's not just, as you know, terms of we hear in nonprofit work or in public health work of chasing the dollars, but it's really building upon community assets with these investments, that it's not just going to be a one-time investment and the program goes away, but it's really thinking about how does this fit into a larger picture of equity, and how are we engaging individuals who we're saying we're trying to address equity with or advance equity with, and how are we centering those individuals and guiding the strategies of the proposal as well. I think is something that was really clear in our proposal, that we're not just talking the talk, but that we're really that we have the infrastructure to do the work that we're proposing around structural racism.
I'll pipe in last. I think for us, it was two pieces that stood out. One was an existing infrastructure through which to channel this work. And it's an infrastructure that's been around for 5 years that we used for our COVID work as well. So there was a proof of concept that the use of this infrastructure could work. And we had not only used it for COVID, we've used it for other work that we have done. And then I think the second piece was really the novelty of what we were trying to do. We're a health department, Health and Human Services. We, unlike other health departments in our state, we don't directly deal with housing unless as it relates to sort of nuisance and public health issues on people's properties. But we're a municipality that has the lowest rate of home ownership in the state, of owner-occupied housing in our state. We're also a municipality that has a lot of programs to help people be able to purchase homes and engage in home ownership activities, but not necessarily a lot of resources to put those two pieces together. And so as a health department, because we often deal with the after effects of having to relocate individuals whose housing is substandard and things of that nature, we chose to focus on housing. And so I think it was a different approach to have a health department looking at housing and looking at ways to increase home ownership in the city in partnership with our housing department. And so I think that was a unique perspective in looking at really looking at those social determinants of health and using home ownership to increase health outcomes, to sort of that role to lead to better health outcomes for generations, but also increase generational wealth, which we know has huge impacts on health as well. And so I think it was both pieces of that helped us stand out.
Wow, thank you all so much. These are fantastic answers. So moving along, I wanted to know if you came across any unexpected barriers while you were applying for funding, and if so, how did you handle it?
I'll pop in on that one. I think for us, when we had this idea of housing, and you have this grant and we're like, we're going to increase the rate of home ownership. And then we took a step back and we're like, wait a second, that's completely and totally unrealistic in 3 years. We can make a good dent in trying to move people towards that. And so we started writing with that. And a week before the proposal was due, I was sitting down with the grant writers and the team. I looked at it, I said, we can't submit this. And we had to sort of kind of go from scratch again as to what we wanted to do in terms of the activities that could lead to some important outcomes that could eventually get us there. And so I think the grant writers and my team wanted to, they were just put it this way, they weren't very happy with me about that process with a week to go. But they trusted the process and they trusted me and we trusted the grant writers in order to be able to take the vision and the concept that we had. So that was a big barrier in terms of once we saw everything written, it just didn't flow and it didn't make sense for what we were trying to do and the levers that we actually have as a health department and as a municipality. And so that sometimes happens. It's happened in the past to us as well. And so that's why having that lead time is good. And the ability to, I always call it a bank of ideas. My staff and I are constantly discussing ideas. I have notebooks where I'm just writing ideas of things, of gaps that we see, so that if we have to pivot for something, we have something that's already that's halfway baked that we can use. And in this case, we were able to really not change what we wanted to do in terms of what we were trying to achieve with the grant ultimately, but pivot the activities that we were doing that made more sense as part of it. But that for us was a barrier we weren't expecting, because we were sort of just head on, this is it, we've got this. And then we sat down and read everything and realized we didn't have it and needed to retool about a third to half of the proposal.
And there is a follow-up question for you about the infrastructure put in place and how that helped you to be successful in your proposal. Are you able to elaborate on that?
Sure. So, you know, in a small municipality like Hartford, 122,000 people, very neighborhood based, very sort of north part of town, south part of town. Lots of organizations are based around not just neighborhoods, but also race and ethnicity. And so we, about 5 years ago, 6 years ago, the conversation started with our hospital systems about creating a healthcare collaborative. And so that conversation really took off when I got here, and we were able to create that collaborative, and that infrastructure ended up being a collaborative with a backbone organization being the United Way, our local United Way. And so it took it out of the hospitals, allowed the hospitals to work together in a more collaborative, non-competitive way. It allowed the community organizations that are already a part of the United Way's network to have an organization that they trusted, that they didn't necessarily see had an agenda per se in this work. And so we were able to, we were co-chairing that, co-chairing the collaborative. And so we were able to use that backbone structure to be able to bring people together around different issues as they come up for grants. And so this collaborative is our REACH collaborative. This is where we funnel REACH work through as well. And so having that set up already with the players that we would be talking to for the most part to get this work done is super helpful. And then we're able to just connect new groups. And so this work around housing, we're able to now connect other groups that we already have some housing folks on this group already, but now we're making that a larger circle, a larger seat at the table for additional housing groups to come in. And so it allows us to be flexible and to move quickly. So we don't have to create a collaborative. We don't have to wonder who the players are. We don't have to invite them to our table. They're already at our table. We already know who the players are, and we're able to bring them on quickly. And this collaborative includes community voices.
Fantastic. Did anyone else have comments about your barriers that you overcame?
Yeah, I wanted to mention that for us as a healthcare system, we're in the business of primarily providing healthcare services. And so this work around structural racism really requires a culture shift of really making health systems responsible for addressing structural issues. So that was kind of the first thing. We have also been building this work through the community organizing and research engagement team, which was created as part of the COVID-19 vaccine work, but really thinking about how to sustain equity work long term. And then this opportunity is also specifically around structural racism. So being selective as to how to do that with $500,000 only per year, and it is a lot of money, especially for some of our smaller organizations, but in the context of structural racism, it's nothing, right? And so being very selective as to how to prioritize, and then prioritizing what community has taught us and what they have shared with us about the experience during COVID-19, and prioritizing that as part of the grant application. The other thing I'll mention too is that life happens, and one of our key writers actually had an incident that didn't allow her to continue to be on the writing team pretty close to the deadline. And so we would have been in a really tight situation if the concept would have been developed by a single person in an office. But because this work really stemmed from community and from community priorities, the entire team and the community was able to contribute to the concept. So we were able to continue with our application as well. So just highlighting the need to really prioritize what community is saying and what's going to really impact community to be able to carry through some of these applications.
Great. I love that. You have to change your whole approach when it comes to equity. It's definitely not status quo, and that is for sure. Any other comments about the barriers?
mean, I think many commonalities, I think, in what many of our co-panelists are saying. I think there's always sort of the idea around, I think there's always sort of the tug and dance when it comes to obviously having a large enough team to support the writing, but also oftentimes making sure that the ideas around the activities and project activities really kind of are conveyed by the individuals sort of, I like on the ground and who know the work. And I think oftentimes there can be a little bit of a tug and dance there, and just kind of navigating that, I think can sometimes be challenging. I remember sort of it's happened in prior grant applications where I have my very clear ideas, and oftentimes writers might say, well, no, this is perhaps like what, and so I think that's always kind of navigating that, and those balances are important. I think that's why having a broad team that knows sort of the project work can be really critical, as was mentioned. And the timelines, I think the timelines are always really hard.
And I know our time is short, but I do see some of these questions are getting answered by our panelists in the Q&A panel, which is, I'm so thankful to you. Aaliyah, did you have any comments you wanted to make about overcoming barriers or any issues you faced along the way?
Yeah, so I don't think that it wasn't necessarily unexpected barrier, but something that can be really challenging is kind of collecting all of the additional appendices that are required that go along with these grants, especially federal grants. So letters of commitment, and you have your letter of support, and there's just a lot, that can go into it. And that, so I think that it's just really, it goes back again to, at the start of it, really read the RFP, have someone outline it, everything that's needed. And then I think it's also really important to, obviously working in a team, everyone, has a bunch of, more than one person collaborating to put this grant together. But I think it's really important to have one final set of eyes too, to make sure that that checklist of everything is complete. And so that, you don't accidentally, leave off an impediment.
Fantastic. Oh, I see a hand from Gloria.
Yeah, I also want to acknowledge that not necessarily in this application, but I also work with several other smaller organizations. And one of the biggest barriers to applying to some of these federal grants is the fact that a lot of them are like reimbursement based. So you don't get paid until, after a quarter or after every month that the work gets done. And that's really difficult for some of our smaller organizations that may not have the cash flow to be able to, manage a grant like that. And so I think this is where us who are bigger organizations or health systems or different entities can really partner, but really think about what does equity mean in these types of partnerships. Oftentimes, for example, the bigger educational institutions have a huge overhead costs, that reduce the amount that's available for the actual work. And so as we think about pursuing this opportunities, like really being mindful about where the equity piece is, and also building capacity of our smaller partners as well to be able to pursue and lead some of this work, because oftentimes they're the ones that are on the ground as well, doing direct response or direct equity work as well.
I love that. So I know we're coming up on time here. I did want to get to this question that I keep seeing. I'm seeing it in the Q&A panel. I saw it in the registration for people who had questions. I know we wanted to talk about writing, but I think it kind of goes hand in hand. Paperwork, registrations, all the little things that you have to do. Any quick comments on what to expect? Expect a lot. Is that the answer?
It's a lot of paperwork. I mean, it's a lot of paper. And I think once you get through one, you have an idea. So even when you don't get funded, I mean, it's a good process because now you have all of the paperwork. You have everything that you need. And so you can build that library of materials that are needed and that just may need to get updated. And so it is a lot of paperwork, your SAM, your EIN, your this, your that, like lots of stuff. And there was just a change in system. So we just got caught up in that as well recently and applying for some grants. So it is challenging, and there is follow-up that happens even when you're not applying for a grant, making sure that things are up to date. And if you're within a larger organization, I think someone said they were part of a healthcare system, they're part of a larger organization. We're a part of a larger organization too. We're part of a municipality. And so while we have a finance office, our finance office has to answer to another finance office, which is a city finance office. And so there are paperwork and things that we have to ask for them. So we often find ourselves asking them for it ahead of time, a couple times a year, just so that we have it. And then we'll just do a check-in before we're doing a grant. Is this the most updated one? Is there anything that's changed? But it is, the act of applying, just that simple act does help you have a better understanding. You know, this for me, it's probably my 10th federal grant in my career. And so you can get them. It's a challenge. But once you get one, you sort of understand that process and you understand the paperwork, because that's the last thing you want, is to not get a grant because you didn't submit a piece of paper. And that does happen. It's happened to us where we forgot a piece of paper and we didn't, you know, maybe we would have not have scored high enough, but maybe we would have, and we will never know because we forgot a piece of paper.
So I know we're about at 5 minutes, and I want to hand it over to Bridget so she can close the event. But before we do, quick fire, we're going to make this one a quick fire. Get ready. We want to know what your one piece of advice would be for our audience members that are seeking funding. So I'll start with Aaliyah.
I would say diversify and get creative. Federal grants are not the only grants out there. You know, there's foundation, there's state, there's, you know, obviously the federal. And so, you know, start small. There's grants out there for kind of everything that you can think of, and it can all help you build up to, you know, the federal level.
Thank you. Sadi.
I'd say be strategic and be prepared. I think that oftentimes if you've had good strategic planning about where you want to take your organization, your community, you can have the data that you need to sort of, and you know, you're doing that in a data informed way. You can support, have data, have paperwork ready to sort of grab the opportunities as they come and really defeat, you know, overcome these rapid timelines.
Great. Gloria?
I would say also in terms of that strategy, think about where this additional funding can augment the work that you're doing. So don't think about it that it has to, you know, be for an entire initiative. Maybe it's part for like a specific subset of that initiative. Maybe it's for capacity building, evaluation. So really think about what the pieces of the mission that you're doing need to be funded, and then use these opportunities to fit that instead of the other way around.
Wonderful. And lastly, Ani.
Sort of building off a little bit of what Gloria said, don't create a program to fit a grant if it doesn't fit your organization. If you have something in mind, wait for the right opportunity. Just wait for the right opportunity and don't try to do something, be it a foundation funder, a local funder, or a federal government funder. Don't write a grant to get the money and it's not something that you're committed to or that you can actually do. Keep your idea and wait till you find the money for it.
Well, thank you all so much. Let's give our panelists a big hand. We are just so fortunate to have you here and as part of our learning community. With that, I will hand it back over to Bridget to close out our event. Thank you again.
Yes, thanks so much. Okay, I'm going to share my screen one last time just to get us through our last final slides. That was really great. So I'm happy, and there's so much information on the slides and elsewhere. So I'm happy we're going to be sending you all the recording and materials as soon as we can after the event ends. But we do have a couple items. We're going to launch a poll. I think Sophia is going to be able to get that onto your screen. And we do ask that you take just a second and fill it out before you go. And while we're doing that, we do have some events that we'd like you all to know about. And Chelsea, if you have that notes page I gave you, if you wouldn't mind, as I mentioned,
am on
chatting it. Okay, so we know that we can't share the links very easily through PowerPoint, so we're going to put them in the chat. But we do have a member orientation for the PAVE learning community tomorrow. It's quick, it's a 30-minute session. And my teammate Luis and I will just share some background on learning community and how to get involved or stay involved. And then next week we have 2 events. The first on Thursday at 1 p.m., collaborating and connecting with faith communities. And then on Friday at 2:30, motivational interviewing. What is it? Why should my vaccine equity program consider it? And all of these are open to any organization, the ones I've just mentioned working on vaccine equity. You don't have to be part of PAVE to be involved in this. The orientation, I'm not sure you would want to be part of that if you weren't part of PAVE, because it's very PAVE specific, but these middle 2, I welcome and encourage you to sign up, even if you don't have PAVE funding. This last one, which we just announced, is reserved for PAVE funded organizations only. It's sort of an end of year celebration event, and it will be held on Wednesday, December 14th at 1 p.m. So hopefully you've gotten all the chats there. I have not seen the poll, but it might be because I am screen sharing. Are we good on that, Sophia? Or others? Oh, there it is. Okay, now I see it. So if you wouldn't mind just going ahead and letting us know what you think about this event or what you thought about it, that's very helpful to us. And lastly, just a huge thank you to our panelists. I'm actually going to stop screen sharing now so that we can all see each other again, and I can say thanks to you all. This has been excellent. Thanks, Chelsea, for your remarks and the helpful information that you shared, and for this being your brainchild, this event. So I think it went really well. Thanks for bringing the idea to us. Hopefully this was very helpful for learning community members and others working on vaccine and health equity. So thanks, everyone. Enjoy the rest of your afternoon, and we'll be sending you all the materials from this event very soon. Thanks, everybody.
Everyone.